Why do you want to become a healthcare assistant?
I chose this path after caring for my grandmother during her final years. I saw how much comfort a kind, patient carer brought to her life. She struggled with simple things like dressing and eating. Watching a carer help her with warmth and respect changed how I saw this job. It wasn't just a task. It was a way to give someone their dignity back. That moment stayed with me. I trained as a healthcare assistant because I wanted to give other families that same relief. Every day I get to make someone's life a little easier. I get to listen, notice small changes, and be there when people feel vulnerable. That feeling of being trusted with someone's care is why I do this work. It still motivates me every single shift.
Tell me about yourself and your background in care.
I have 3 years of experience working as a healthcare assistant in residential and hospital settings. I hold a Level 2 diploma in health and social care, along with training in manual handling and infection control. My background includes supporting elderly patients, people with dementia, and those recovering after surgery. I'm known for being patient and calm, even during difficult moments. I listen carefully to patients and pick up on small changes in their mood or condition. I work well under pressure and enjoy being part of a team. Colleagues often say I bring a steady presence to the ward. Outside formal training, I've learned a lot simply by spending time with patients and understanding what they need. That combination of training and real experience is what makes me effective in this role.
What do you find to be the most rewarding part of this role?
The most rewarding part is helping someone hold on to their independence. Small things matter a lot to patients. Being able to wash themselves, choose their own clothes, or walk to the bathroom alone can mean everything to them. I remember one patient who hadn't smiled in days. After I helped her feel steady enough to walk to the window herself, she thanked me quietly and smiled for the first time that week. Moments like that stay with me. I also find it rewarding when a patient trusts me enough to open up about their fears. Being that steady, calm presence for someone during a hard time feels meaningful. It reminds me why I chose this career. Helping people feel human again, even in small ways, is what keeps me motivated.
What do you consider to be the most challenging aspect of being an HCA, and how do you manage it?
The hardest part is emotional fatigue. Caring for people who are unwell or in pain, day after day, can wear you down. I once cared for a patient who was dying, and I stayed calm for her family while feeling deeply sad myself. To manage this, I talk to colleagues after difficult shifts instead of holding it in. I also make sure to rest properly and keep some separation between work and home life. Exercise helps me clear my head. I remind myself that showing emotion is normal, but I need to stay composed while on duty. Over time, I've learned to recognize the signs of burnout early, like feeling irritable or tired all the time. Taking small breaks during shifts also helps me stay present and patient with each person I care for.
Where do you see your career heading in the next few years?
I plan to keep building my skills as a healthcare assistant over the next few years. I want to take further training in dementia care and wound management, since these are areas I find both challenging and important. Longer term, I'm considering training as a nurse. Working closely with nurses has shown me how much more I could do for patients with that qualification. For now, my focus is on becoming excellent at this role and learning everything I can from the team around me. I enjoy the hands-on side of care and want to keep developing that. Whatever path I take, I want to stay close to direct patient care because that's the part of the job I value most. Continuous learning is something I take seriously in this field.
How do you maintain a patient's privacy and dignity while performing personal care?
I always explain what I'm about to do before I start, so the patient isn't caught off guard. I close curtains or doors first and keep the patient covered as much as possible during washing or dressing. I once cared for a man who was embarrassed about needing help bathing. I spoke to him calmly, let him wash the parts he could manage himself, and only helped where necessary. This gave him back some control over the situation. I also avoid talking about him in front of others and keep my tone respectful throughout. Dignity is really about small choices, like knocking before entering or asking permission before touching someone. I try to treat every patient the way I'd want a family member of mine to be treated. That mindset guides everything I do during personal care.
How would you handle a patient who is confused, agitated, or aggressive?
Once, a patient with dementia became agitated during the evening and started shouting. I kept my voice low and calm, and stood at a safe distance rather than crowding him. I avoided arguing with him or correcting his confusion directly. Instead, I gently redirected the conversation to something familiar, like his family. Slowly, he calmed down. If a situation feels unsafe, I always step back and call for a colleague rather than trying to manage it alone. Safety comes first, both for the patient and for staff. I also try to figure out what triggered the agitation, like hunger, pain, or noise, so it doesn't happen again. Staying calm myself is the most important part. Patients often mirror the energy around them, so my composure can help settle things down quickly.
What would you do if a patient completely refuses your care?
I once had an elderly patient refuse to get washed one morning. Instead of insisting, I sat with her and asked why she didn't want help that day. She told me she was simply tired and wanted to rest. I respected that and offered to come back later, which she appreciated. I made sure to document the refusal and inform the nurse in charge, since it's important the wider team knows what's happening with her care. Patients have the right to say no, and forcing care would only damage trust. My job is to understand the reason behind the refusal, not just accept it blindly. Sometimes it's fear, pain, or simply feeling unwell. Giving patients space and coming back with patience usually works better than pushing them in the moment.
Can you describe how you would help a patient who has just suffered a fall?
During one shift, a patient slipped while walking to the bathroom. I didn't rush to pull her up. Instead, I stayed calm, knelt beside her, and asked if she was in pain or felt dizzy. I checked for obvious injuries like swelling or bleeding. I kept talking to her gently to keep her calm and reassured her that help was coming. I pressed the call bell immediately and stayed with her until the nurse arrived. We didn't move her until she'd been properly assessed in case of a fracture. Afterwards, I helped complete an incident report detailing exactly what happened. Falls can be frightening for patients, so staying calm and present matters just as much as the physical response. Following protocol protects the patient from further harm.
How do you ensure you are culturally sensitive when caring for patients from diverse backgrounds?
I always ask patients directly about their preferences rather than assuming. I once cared for a patient who followed strict dietary rules for religious reasons. I made sure the kitchen was informed and double-checked her meals matched her needs. I also respect modesty preferences during personal care, such as allowing a family member of the same gender to assist when requested. Language barriers can be a challenge too, so I use simple words, gestures, or translation tools when needed. I try to learn a little about different cultural practices so I don't accidentally cause offense. Every patient is different, even within the same background, so I never make assumptions. Being open, asking questions, and listening carefully is the best way to give respectful, personalized care.
How do you prioritize your tasks on a fast-paced, understaffed shift?
During a particularly short-staffed night shift, I had several patients needing attention at once. I quickly assessed who needed help most urgently, starting with a patient who'd rung the emergency bell. Routine tasks like restocking supplies were left until later. I kept a mental note of smaller jobs so nothing was forgotten, and updated colleagues briefly when I could. Patient safety always comes first, followed by comfort needs like pain relief or toileting. I also asked for help when I realized I couldn't manage everything alone, rather than letting quality slip. By the end of the shift, every patient had been seen and nothing urgent was missed. Staying organized and communicating clearly with the team made a stressful shift manageable.
What would you do if you noticed a change in a patient's physical or mental condition?
I noticed a patient becoming unusually drowsy and slower to respond during a routine check. I immediately took her vital signs and recorded them accurately rather than guessing from memory. Her blood pressure had dropped noticeably from earlier readings. I reported this straight away to the registered nurse on duty, giving clear details about what I'd observed and when. Early reporting like this matters because small changes can signal something serious. I stayed with the patient until the nurse arrived to assess her further. Documentation is just as important as the observation itself, since it creates a clear record for the wider team. Acting quickly, rather than waiting to see if things improved, ensured she got the right attention in time.
How do you approach patient confidentiality?
I take confidentiality seriously in every part of my work. I never discuss patients in public areas like corridors or break rooms, even casually. When I step away from a computer with patient records open, I always lock the screen first. I only share information with colleagues on a need-to-know basis, and never with family members unless the patient has given permission. I remember a situation where a visitor asked me about another patient's condition, and I politely explained I couldn't share that information. Protecting patient privacy builds trust, and trust is essential in care work. I also make sure physical notes aren't left lying around where others could see them. Following these rules isn't just about policy. It's about respecting each patient as a person.
What would you do if you witnessed a colleague treating a patient poorly or breaking protocol?
My responsibility is always to the patient first. If I saw a colleague speaking harshly to a patient or skipping a safety step, I would address it, even though it's uncomfortable. I once noticed a colleague rushing through a hygiene procedure that risked infection. I raised it with them directly at the time, and when it continued, I reported it to my manager through the proper channel. Staying silent would put patients at risk, and that's something I couldn't accept. I understand this isn't about getting someone in trouble, but about protecting vulnerable people who can't always speak up for themselves. Whistleblowing procedures exist for good reason, and I would use them without hesitation if a patient's safety or dignity was compromised.
Describe a time you had to work closely with other medical professionals.
While supporting a patient recovering from hip surgery, I worked closely with a physiotherapist and the ward nurse. The task was to help the patient regain mobility safely without setbacks. I followed the physiotherapist's exact instructions on how to assist with walking exercises and reported any pain or dizziness the patient showed during sessions. I kept the nurse updated on how the patient managed daily tasks like dressing and eating. Communicating clearly between all three of us meant the patient's care plan stayed consistent. Within 2 weeks, the patient was walking independently and was discharged ahead of schedule. This experience showed me how much smoother recovery becomes when everyone shares information openly. Good teamwork isn't just helpful, it directly improves patient outcomes.
Are you comfortable performing repetitive or physically demanding tasks?
Yes, I'm comfortable with physically demanding tasks, and I've been trained in safe manual handling techniques. I know how to use hoists and slide sheets correctly to protect both the patient and myself. If a task feels too heavy to manage safely alone, I always ask a colleague for a second pair of hands rather than risking injury. I once had to help move a larger patient who needed repositioning every 2 hours to prevent pressure sores. I made sure to follow the correct lifting posture each time, even when tired. Repetitive tasks don't bother me, since I understand how important they are for patient comfort and health. Safety always comes before speed, both for my own well-being and the patient's.
What steps do you take to prevent infection control failures on the ward?
I follow the 5 moments of hand hygiene closely, washing my hands before and after every patient contact. I always use the correct PPE for each task, whether that's gloves for personal care or an apron for cleaning. I dispose of biohazardous waste in the correct bin straight away, rather than leaving it lying around. I also check that equipment like blood pressure cuffs is cleaned between patients to avoid cross-contamination. On one occasion, I noticed a colleague reusing gloves between patients, and I reminded them gently of the correct procedure. Small habits like these prevent big problems. Infection control isn't just a rule to follow. It directly protects vulnerable patients from serious harm. I take it seriously every single shift.
How do you ensure accuracy when taking and recording patient vital signs?
I always take my time when recording vital signs, rather than rushing between patients. If a reading looks unusual, like a very low oxygen level, I check it a second time before recording it. I write results down immediately after taking them, instead of trying to remember several readings at once. I once noticed a patient's temperature was much higher than her previous reading, so I retested it and reported it straight away rather than assuming it was an error. Accuracy matters because small mistakes can lead to missed warning signs. I also make sure equipment is working properly before use. Consistent, Careful recording gives the nursing team reliable information to base decisions on, which ultimately keeps patients safer.
Tell me about a mistake you made at work and how you handled it.
Early in my career, I once gave a patient their meal without checking her updated dietary chart, which had recently changed due to a swallowing difficulty. I noticed straight away that something felt wrong and immediately told the nurse in charge rather than staying quiet. The patient was checked and thankfully had no ill effects, but it was still a serious lesson for me. Afterwards, I made a habit of double-checking dietary charts before every meal, without exception. I also spoke to my supervisor about how to avoid similar mistakes going forward. Owning up quickly, rather than hiding it, meant the situation was handled safely. That experience taught me how important small checks are, and I've never skipped one since.
Why do you want to work for our specific healthcare facility?
I've read about your facility's strong reputation for dementia care, which is an area I'm passionate about. Your focus on person-centered care really stood out to me, especially your program supporting family involvement in daily care decisions. I like that your team values continuous training, since I'm someone who wants to keep learning throughout my career. I also spoke to a former colleague who worked here and described a supportive, well-organized team environment. That matters a lot to me, since good teamwork directly affects patient care. I want to work somewhere that shares my values around dignity and respect for patients. Everything I've learned about your facility suggests it's a place where I could grow while genuinely making a difference for patients.